biggest challenge, of course, right now when we're looking at when you're fighting against COVID-19, what we see is lakhs of migrant workers fleeing cities, they're jobless, homeless, and all of them are hungry. We believe you were involved in several relief efforts to feed the migrants. Can you tell us about your initiative?
Yes, I think the pandemic has taken a toll in different ways. And in terms of food becomes the first priority for everyone. Anyone who has it, make sure that it's made available to people who don't. And during this time, I could start an initiative first in Mumbai. I had never heard, living in Mumbai, I had never heard of Kasturba Gandhi Hospital. So initial days when I heard about it, then I thought that we should do something about it and give food to the doctors and all. And then I joined hands with the Taj Group of Hotels and we initiated a lot of food for hospitals all across India. And then combined with the hotel and restaurant industry, started looking at providing food to migrant people all across.
At this time of the pandemic, due to isolation, fear, a lot of mental health issues have been triggered, like depression, anxiety. As someone who suffered from anxiety myself, I understand that it's very difficult at first to ask for help. So what is your advice on how to tackle this and the stigma around mental health at a time like this?
Last 6 months have been about taking care of our physical health. But the next 6 months to a year, we must focus on our mental health. As Mr. Bachchan himself has been talking about it, that, the fear before getting COVID, okay, half our country has been through it. Then when you think you have COVID, people are so scared to even test because it's like a stigma getting COVID. The anxiety goes up, the depression goes up, the loneliness itself goes up. Now, just to quote some statistics, 1 out of every 7 Indians, even before the pandemic hit us, is supposed to be suffering from a diagnosable mental health condition. The stigma about taking help, सिर्फ पागल लोग साइकाइट्रिस्ट के पास जाते हैं, ये स्टिग्मा हमें दूर करना है. And let me tell you, कोई इससे nobody is away from this. छोटे से बच्चे को भी साइकाइट्रिक प्रॉब्लम हो सकती है, तो बुजुर्ग को भी हो सकती है.
As you talk, I just want to let you know that I have recently also been involved in this side of the health process on mental health, and we've been doing a lot of work with institutions. One very powerful institution called Empower, and I've become a part of it, and very soon you shall be hearing more about what mental health means, what depression means, and particularly so during the time of COVID. I was just talking to everyone here. One of the things that happens during the process of being ill in hospital is that, as I said, human beings need to see another human being. And when they don't see another human being for a very long period of time, this is bringing on depression.
Mr. Sangma, Meghalaya has been praised by the WHO for managing to really control the number of corona cases. Can you tell us how this was managed?
When the situation came up, we had in fact taken steps I think a week or 2 weeks before the lockdown started in the country as a whole. And in that entire process, what was very important for us was to respond early. We also had a very strong movement at the community level. And I think the community participation was most probably the biggest strength for our state. But I think as we went along the way, the balance really and the options in front of us are limited. How long can we remain closed? How long can we continue like this? So I think at the end of the day, what is very important and is emerging for us in our state is the behavior change is going to be the key to everything. And I think that aspect also started very early in our state.
We've spoken about hygiene and sanitation, but perhaps none of it would matter if there isn't proper nutrition. From the day when the baby is conceived, we need to ensure proper nutrition for the mother and the baby.
Dr. Bhandari, we've had a huge issue of early marriages. Let's start from there. Because, when young girls give birth, their bodies aren't prepared. Many a times, they have health risks, and this actually leads to the intergenerational cycle of malnutrition. So when we're talking about the first 1,000 days, when we're talking about a healthy child, obviously the mother has to be healthy.
Let me tell you, intergenerational cycle basically implies the period between childhood through adolescence and motherhood. So if we look at the data, NFHS, we found that 1 in 2 child is anemic, and 1 in 3 is stunted, and 1 in 4 is low birth weight, and 1 in 5 is wasted. So this is pretty dismal, but we have come a long way since then. So the Government of India launched a very ambitious and a flagship program by Poshan Abhiyan, which was launched in 2018 by the Honorable Prime Minister. And this was designed to provide a continuum of care to address the 1,000 days, which is the critical window or the first window of opportunity. And this is a comprehensive package of convergent interventions across multiple government schemes, sectors and programs.
The first 1,000 days actually starts from the day of conception, sir, and goes on till the child is 2-year-old. This is a unique period of a life of a child while inside the mother and after he or she is born, because this is the foundation period of the entire life. The entire growth of all the organs, and especially the brain, happens at this time. Therefore, if coverage is given, proper coverage is given of nutrition, health, and other supportive factors, the entire life of the person becomes protected. And therefore, this 1,000 days is very critical in the life of any human being, right from conception till 2 years of age.
Neha, you have been working on spreading awareness on breastfeeding. In fact, last year on 2nd October, you were here on this platform, you joined us and you were telling us about, how you wanted to work on this. And in the last year, I've seen you've done a lot of work on this. You started Freedom to Feed. What was your thought behind it?
Last year on the 2nd of October, when I was sitting on the panel, got a huge amount of encouragement sitting over there that day. And I was like, I need to take this voice forward. It's been a year. We built a very large community of mums and experts where we talk about freedom to feed. And freedom to feed is a place where we come of lack of any sort of judgment. The only thing that we advocate as far as mums or new mums is concerned is that every mother in their own right is amazing and is trying to do her version of what she thinks is perfect for her child. I always say this, that in rural areas, women are far more empowered when it comes to breastfeeding. It's like wherever they want to feed the child, they go ahead and do it. Even for us, we can do it as moms, but I just feel that the facilities are lacking and we need a lot more facilities over here.
We do know breastfeeding is very important, but many a times, a lot of mothers cannot feed their child for whatever reason. How does a mother actually cope with that?
I always say breastfeeding is the most natural and the easiest method of feeding a mother can do for her own baby. There's a number of factors that affect how the feeding works from there on. There is a lot of people who are giving advice to the mother. I always feel that the mother's instinct is the right instinct, and usually most of the mothers get it right. But there's a lot of people advising the mother what to do. And especially at this vulnerable period, if there are a lot of people giving you wrong advices or many advices, it's very difficult for the mother to concentrate on the feeding. In our hospital, in fact, we sensitize both the mother and the father. I think the father also plays a very crucial role in getting the mother to successfully breastfeed the baby.
I think the fathers should don the role of being a protector, which is very important. When the baby and the mother are in the hospital and the mother is nursing, it's a very sensitive time for both of them. The mother can get exhausted. She will be tired. She will be cranky. She will have a lot of her graph will be very up and down emotionally, physically. It's a very demanding job, sir. So I think you have to be there all the time. I and Neha did witness was postpartum. And I think that it's very important that we educate our men in our country as to what postpartum really actually means.
How has COVID-19 affected the nutrition landscape in India?
I think COVID, and more particularly the strategies that we have adopted to contain the spread of the virus, have almost devastated everything. And we're going to see a significant slide back in the progress that we have made in malnutrition elimination, as well as a surge in cases of malnutrition. As you know, we know that the root cause of malnutrition is poverty, and the millions are going to be pushed into poverty from the edges, and that will lead to more hunger and malnutrition. And particularly when there is a crisis, the people affected, women and children, suffer most. And when the going is good, women are the last to benefit, when the going gets tough, women are the first to be sacrificed. And women, particularly the pregnant women, require more nutrition during pregnancy. Nutritional intake in pregnant women would come down, and that is going to result in a surge in the low birth weight babies.
Would you like to tell us something about these nutrition impact bonds? What are these?
This is our second year of program on nutrition which is running. And we have reached out to around 1,000 villages across Nandurbar and Amravati districts of Maharashtra. We are taking our program to 50% of the aspirational districts in India, which means like, these are those districts which are poor in the health indicators, poor on the nutrition indicators, poor on education indicators and many other things. There are total 49 of those indicators. So what we have chosen is like, we will be going to the LWE districts, which are the left-wing extremist districts in India, which really need our intervention and support. And we plan to cover 50% of the districts in India which really need the help, and we will be able to do it in next year, by the end of the next year. The return on investment from our last year work is 1 rupees invested in the program has given us return of around 37-38 rupees.
Oh, that's where the formula comes from.
So yes, very true. Okay. So interesting bit is like, when you do a standalone program on hygiene or hand washing, the return on investment comes from, by spending 1 rupee, you get 33 rupees return on investment. When you do an intervention which is standalone nutrition intervention, when you spend 1 rupee, it's 22 or 23 rupees. But when you have a blended program where you have the breastfeeding, you have the breastfeeding pods, you have nutrition specific interventions, you have hand washings, you have early referral of the kids to the nearby healthcare facilities, the return on investment goes very, very high. Amitabh sir, it's a great thing to tell you, like, the intervention sites where we have worked, in last 1 year there are 0 deaths, sir, of the kids. So the 1,000 villages which we have chosen, and it's not our data, it's the government data as well as the third party audits, they have done the audits on that.
This Nutrition India program, like it's probably one of the only program which has looked at, taken a public health approach to nutrition. Taking a holistic approach to this initiative, we have been successful in supporting over the last 12-15 months that the program has been on the ground. Ensuring that 32,000 children, under 5 children, they and their parents and caregivers, they have received the support and information and protection that they need to ramp up nutrition and be healthy.
In the pandemic, as millions suffer, perhaps there has been little or no focus on some of the most vulnerable groups of our society, those living with HIV and the marginalized communities like the transgenders and the LGBTQ population. Ashokji, let me come to you here first and ask you, tell us about how has this pandemic been, what are the challenges you've seen during this pandemic?
Who we talk as key population are the populations who are the most marginalized in the sense they are unwanted in society. They're harassed. There is sexual violence. There is a lot of stigma and discrimination against them. When COVID hit the ground, we could see that. We could see, for example, on the streets, police were beating up hijras not to be there. And that is the only place they can earn a living. For example, badhai, begging at street corners, or sex work in the evening. It's either women in sex work, street workers, or hijras, or what are called kotis, who were actually at the receiving end of the violence by the police, by the people. They didn't want them anywhere near them. So where do they go? You can't, you have to, they are human beings. They need support. They are vulnerable. The government of India owes them, as citizens of this country, owes them at least a living or a sustainable sort of life. If you say all the time that you have to use sanitizers, you have to wash your hands, where is the water? And I'm very proud that we ourselves have got together to reach out to our people, because we haven't got really any government help.
Lakshmiji, what are the needs of the community at this point in time?
The transgender gets hit so much because we are the only sexual minority which is visible. And visibility puts you a layer of stigma and discrimination continuously. And with COVID-19, what happened, I always said that we may not die of COVID, but we may die of hunger. The issue at present, which is really relevant for the community, is housing, that is shelter, and food, and access to quality health. When you talk even about HIV, the most high-risk community is a transgender community. And what Ashok also said, sir, that today the community is ready to do anything. हमारी जिंदगी कैसे बसर होती है, चाहे वो बधाई हो, चाहे वो बस्ती हो, बस्ती मतलब बेगिंग हो, स्ट्रीट्स पे सिग्नल्स पे लोग खड़े होते या अपने बदन बेचने पे मजबूर करते. तो I always say the sex work of transgender community is society pushed. You know, the society is the stakeholder where society didn't accept us.
This is where I would like to come to you. I think it's, somewhere the awareness is not there. We need to sensitize people about this. In fact, RB aims to reach out to over 1 million LGBTQ population in 23 states in the next 3 years. How do you plan to do this?
When I was thinking about this whole program, I took a lot of inspiration from Ashok, from Lakshmi and many others I have worked with. In the year 2020, year 2021, what we plan to do is to reach out to 100 plus community-based organizations across India. We have put a dedicated team who is working ethnographically on the, on the needs of the communities. We have also been helping those, like Lakshmi has very rightly pointed out actually just now about the food. We have met more than, 800 people who were actually foodless from last 10 days or 15 days on an average. We also saw like there are a lot of challenges like, मजबूरी इतनी ज़्यादा है कि अब body को बेचने का भी situation आ जाता है. So therefore the risk level increases many folds. So now the STI clinics are closed or semi-operational. Your HIV treatment is, you're not getting that treatment if you are infected. So how to do the self-risk assessment? So we are going to a module now where people can do, like you have the Arogya Setu app, you can do your self-risk assessment. In the same way, self-risk assessment can be done on your phone by looking into the 10 questions, and then you can seek the help in the network. So we have mapped the services, we have mapped the private providers, public providers, and the work is basically largely to strengthen these communities because the vulnerability is at the, is at the peak.
In regards to the concern of the pandemic triggering a higher rate of HIV prevalence in key population, what is your opinion on the same?
When the issue came up, the first thing which UNH has really tried to help the UN to understand is this whole issue of vulnerability which we are talking about. That's why we have promoted the fight against discrimination, against the stigma, helping some of the ministries of social justice and empowerment to really open up for specific advantages for our key populations. So if we want to have really a solution, we have to really be proactive, move together and make sure that any piece which is coming to the community is involving our key populations.
In India, if you're not heterosexual, there is a massive social stigma, and that's what we were talking about right now. It is here that with the family needs to support, they need to, help their children if they get to know about it. I think talking to your children is also very important. Arunaji, let me come to you here and ask you, 13 years ago, your 17-year-old son came out to you and he's told you that, he was gay. What was your reaction at that point? And this is way back, 13 years ago.
My reaction was really very cool. Because he had already checked with me 15 days ago whether I know about being gay and all that. So my reaction was very cool. And then because it was not him, but I asked him that, are you gay? He just got up and came and hugged me and asked me whether I still love him or not. And I told him that, yes, of course, now I love you even more, because it was not that, it was the unconditional love that made me think that why he was so scared, to come out, because it took very long. I mean, I did not know that how my life is going to move forward, but and being like gay child, mother of gay child, So I told him that I am absolutely fine and I love you. And then I took him out for dinner and told him that I love you regardless of your sexuality.